I will now order oral questions put by members to ministers. The time is now 3:21. We will finish at 4:51. The Honourable Leader of the Official Opposition.
Thank you. Thank you, Mr. Speaker. Today, the Auditor General released the fall 2012 report. In the report, the Auditor writes, and I quote, "Trade Centre Limited does not have an adequate internal control framework or sufficiently rigorous financial management processes," end of quote. My question to the Premier, how could the government give $4.8 million to an organization with such weak financial controls?
Honourable the Premier.
Mr. Speaker, the Auditor General made a series of recommendations with respect to the operation of Trade Centre Limited. We have, in fact, accepted those recommendations, and that work is going forward.
Honourable Leader of the Official Opposition on his first supplementary.
Mr. Speaker, the Auditor General's report continues, and I note blank checks were not adequately safeguarded, purchase orders were filled out after goods and services were obtained, purchases were made without the required purchase orders, spending was improperly tracked and not accounted for, improper financial management, wasting taxpayer dollars, and this government's economic development minister is responsible for the oversight of the Trade Centre. My question to the Premier, what repercussions will the minister face for such a giant failure to protect taxpayers' money?
Honourable the Premier.
Mr. Speaker, I would point out that the boards that were in place at Trade Centre Limited and the practices that they developed over many years, well before we were in government. In fact, Mr. Speaker, it's as a result of the work that was done by the Auditor General and the changes that we have brought into those exact processes that the Leader of the Opposition had pointed out, which is going to make for a more transparent and open and accountable system, Mr. Speaker.
The Honourable Leader of the Official Opposition on his final supplementary.
Speaker, it's almost 4 years into the mandate of this government. You would think they would have dealt with protecting taxpayers' money a lot sooner, Mr. Speaker. Mr. Speaker, this report says the market projections prepared by the Trade Centre Limited staff for the new convention centre were, and I quote, lacks appropriate analysis and rigor expected for such an assignment. Important industry realities such as an excess supply of the convention centre space, new competitors, and a stagnant convention centre market have not been adequately considered or assessed, end of quote. Mr. Speaker, in light of what the AG has to say, my question to the Premier is, what is the government going to do to ensure that the people of Nova Scotia continue to have confidence in this new trade centre?
Honourable the Premier.
Thank you, Mr. Speaker. In fact, there were 8 different reports commissioned. They were posted on the website of the Trade Centre Limited for all to see. At that time, what was expressed by the members of the opposition was why weren't we getting on with actually approving the Trade Centre agreement at the time. We took the time to go through it comprehensively to make sure that this was the best possible agreement for the province, Mr. Speaker. We believe that the one thing that is absolutely true is that unfortunately Halifax did not have a convention centre that was adequate to meet its needs, and that the new convention centre will in fact do that. We'll have the opportunity to attract larger conventions from across the country. This will benefit not only Halifax but indeed all of Nova Scotia.
The Honourable Leader of the Progressive Conservative Party.
Thank you, Mr. Speaker. My question is to the Minister of Health. Today, the Auditor General reported that Capital Health had proposed a project to the Minister's Department that would save all Nova Scotians $3 million each and every year. Mr. Speaker, that's a $3 million opportunity for savings that could be put into actual better health care delivery, but it was rejected by the Minister's Department. Mr. Speaker, it's time to stop wasting these opportunities to save money and actually make health care better. So my question to the Minister is this: can he explain why his department rejected an opportunity to save taxpayers $3 million in health care?
The Honourable Minister of Health and Wellness.
Well, Mr. Speaker, there's a lot I could say with that question from the Conservative Party, Mr. Speaker. Anybody who has wasted money with health care, it was the former government, Mr. Speaker. They, no question, has put this province in a financial position that had limited future investments. And I'm very glad and appreciative of the work that Capital Health does on behalf of Nova Scotians when it comes to healthcare services. And this government will continue to make the right investments when it comes to capital projects here in Nova Scotia, Mr. Speaker.
The Honourable Leader of the Progressive Conservative Party on his first supplementary.
Thank you, Mr. Speaker. I'll just table for the benefit of the minister the message from the Finance Minister for the financial statements for 2009, which reported that the province was in a surplus position of $19.7 million when he and his gang took over. To quote the Auditor General today, Mr. Speaker, the Auditor General said the Department of Health and Wellness is not fully exploring areas which could generate operational cost savings. He gave one example, which is that they were given a chance to save $3 million each and every year that could be redirected into more nurses or more long-term care beds or more of whatever Nova Scotians need, Mr. Speaker, but instead they rejected that report. So my question to the minister is this: what other cost-saving opportunities has he rejected in his time as minister?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. What we've rejected as when we came into government, Mr. Speaker, is the practices of the former government. We recognize the importance of investing appropriately in health care, Mr. Speaker. We've worked extremely hard over the last 3 years to ensure that we make the right investments, especially in health care, but in all departments across government, Mr. Speaker, because we were left a financial mess, but we're going to clean it up.
The Honourable Leader of the Progressive Conservative Party on his final supplementary.
Mr. Speaker, the government inherited a surplus of $19.7 million. According to the Auditor General, the same one who is now criticizing this minister and his department. It would be great, Mr. Speaker, if the minister would actually speak to his own term in office. Mr. Speaker, in the health budget for this year, the Auditor General points out that the minister's department allocated a total of exactly $0 for health equipment. Now, that defies common sense, because obviously we're going to need to buy health equipment year to year. This was pointed out by the opposition at the time of the budget, but the minister rejected the arguments that zero was the wrong number. And today we find out, Mr. Speaker, that the Auditor General says that the minister had to raid money from the emergency fund to pay for health equipment. And so my question to the minister is simply, when will he get serious about saving money in bureaucracy and actually put some of that savings back into frontline health care?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. And as usual, what the member said opposite is just not true. We've invested this year in investing in healthcare capital costs, Mr. Speaker. And the only thing that keeps me up at night is just wondering what we could have done with nearly $80 million of overcost to the Colchester Regional Hospital because of the mismanagement of that project from the former government, Mr. Speaker. Those are the facts. Those are the facts, Mr. Speaker. They didn't do the right job when they were in government, Mr. Speaker. We're doing the right job ensuring that we invest appropriately in healthcare services, Mr. Speaker. We're ensuring that we reduce administration costs, Mr. Speaker. When they were last in government, we had one of the highest health administrative costs in the country. We were below the national average today, Mr. Speaker, and it's because of the hard work of this government.
The Honourable Leader of the Official Opposition.
Mr. Speaker, based on today's Auditor General report, we have learned that the Health Department's level of IT security is weak at present, Mr. Speaker, and I quote, an unnecessary high risk from internal threats, that all overall levels of control is inadequate and must be improved, end of quote. So my question to the Premier, why is the government so comfortable with what are clearly low levels of security currently guarding personal health information?
Honourable the Premier.
In fact, Mr. Speaker, quite the opposite is true. Shortly after coming into government, we undertook an analysis of just exactly these kinds of difficulties. In fact, we've passed the Personal Health Information Act, which is going to come into force in December, and it's going to resolve much of the problems that the Auditor General has identified.
The Honourable Leader of the Official Opposition on his first supplementary.
Mr. Speaker, I don't know what the government did when they came into power, but the Auditor General said today, Mr. Speaker, that personal health information, Mr. Speaker, is not being secured by this government. Mr. Speaker, this government must be familiar with the province's level of IT security, considering it was hopefully just reviewed as part of the government's $100 million deal with IBM. In fact, the province has paid a consultant company $30,000 to do a review, Mr. Speaker. The consultant must have missed what the Auditor General found, Mr. Speaker. The AG wrote, and I quote, "Most of the IWK's published policies and procedures are not up to date, and there's no process to keep them current," end of quote. So my question to the Premier, with such security failings and shortcomings, why didn't the government ensure that the province's current practices are sufficient and secure?
Honourable the Premier.
Quite the opposite, Mr. Speaker. As I pointed out to the Leader of the Opposition, we actually came in, we brought forward legislation which we've passed. There is a program of implementation that's underway. We're doing it to fulfill and to fix exactly the kind of problems that the Auditor General found, which he found after we found them, and we implemented a program to make sure that they get fixed.
The Honourable Leader of the Official Opposition on his final supplementary.
Mr. Speaker, as recently as Thursday, the government stood in this House and said its security protocols were sufficient to keep Nova Scotia's data safe, Mr. Speaker. But today, the Auditor General said otherwise, Mr. Speaker, and I wonder who Nova Scotians are going to stand behind, that Premier or the Auditor General, Mr. Speaker. Mr. Speaker, the Auditor General says there's a critical security vulnerabilities in the management of health information. So my question to the Premier, with the government's decision to outsource to IBM, why should Nova Scotians feel their information is any safer?
Honourable the Premier.
Well, Mr. Speaker, no surprise. That's a misrepresentation of what the Auditor General actually said. The Auditor General is concerned with is actually internal security, where people who are working in the system have access that they shouldn't have. That is exactly the kind of fixes that we're putting in place. The overall security from people for outside, that was not part of the criticism that was being leveled in the AG's report. And as I pointed out, we actually did the work to identify this. We brought forward the legislation. We put in place an implementation plan, which we are implementing. And in December, I believe, we will be able to actually bring forward that legislation in full and resolve the very issues that the AG has pointed to.
The Honourable Leader of the Official Opposition on a new question.
Thank you, Mr. Speaker. Today, the Auditor General's report was revealed that we will require $600 million over the next year, 10 years, in order to cover just the basic infrastructure needs of our healthcare system. Mr. Speaker, $60 million a year every year for the next 10 years. Just to maintain the system as it now exists, Mr. Speaker, with no improvements, just to maintain the system we have. DHAs have been stretched to their limit when it comes to budget cuts from this government, Mr. Speaker. To make matters worse, Mr. Speaker, the new Conservative Health Care Accord will kick in soon, which will see Alberta receive an additional $1 billion from the federal government, Mr. Speaker, and Nova Scotia will receive less. So my question to the Premier, could the Premier tell us how his government plans to systematically address the $60 million a year shortfall in the infrastructure deficit of the province of Nova Scotia?
Honourable the Premier.
Well, Mr. Speaker, again, no surprise. The information put forward by the Leader of the Opposition is wrong. It's actually a floor, so what Nova Scotia receives will not go down. But nonetheless, we are concerned, of course, about transfers, about health transfers in particular, because in this country, it is the Atlantic provinces that have the oldest population, and therefore the ones who are likely to see the greatest deal of stress on the system as we go forward. So, for example, Mr. Speaker, we build 1,000 new long-term care beds and strengthen the long-term care system, but still we see increases in health care costs associated with long-term care because more and more people are coming into the system. That's a very natural thing. It is what governments are going to have to manage in the years to come as we are today.
The Honourable Leader of the Official Opposition on his first supplementary.
Mr. Speaker, with that answer, it's little wonder the Premier has said very little about what the federal government is doing to health care transfer to the province of Nova Scotia. Mr. Speaker, it's going down because it's not being adjusted for inflation, Mr. Speaker. In any other place, that means it's going down, Mr. Speaker, and Nova Scotians lose. Mr. Speaker, the revelation today is around $600 million. Hardly could be surprising. What we have seen is two successive governments in this province, the current NDP government and the previous Conservative government, who took a hands-off approach to health care. My question to the Premier, could the Premier tell us how his government plans to come up with the $60 million a year in order to address the health care infrastructure deficit which was allowed to develop due to failed leadership?
Honourable the Premier.
Again, Mr. Speaker, the information just asserted by the Leader of the Opposition is wrong. In fact, the plan is to adjust for inflation. The problem is that inflation does not actually represent what the increase in costs in health care are. So, Mr. Speaker, that's part of the problem. Is it's been a retrenchment from the manner in which it has been done before. We, of course, have made this absolutely clear to the federal government, certainly in my role as the chair of the Council of Federation, when we talk with all of the other premiers, and I'm pleased to represent them in discussions with the federal government. We make these points regularly. But I would point out to the Leader of the Opposition that in this year alone, Mr. Speaker, the capital grants for health care in this province is some $72 million, exceeds the $60 million figure that he points out, but it still is a challenge for us to balance the financial needs in all of the sectors with the financial needs in health care.
The Honourable Leader of the Official Opposition on his final supplementary.
My figure, Mr. Speaker, it's the Auditor General's figure. It says there's a $600 million shortfall. Mr. Speaker, we're simply asking the Premier what provisions have they done to deal with the $60 million shortfall a year, and he stands up supporting Prime Minister Harper's bill to reduce health care transfers to the province of Nova Scotia. I wish he would stand in his place and tell Nova Scotians why he's endorsing the Prime Minister's hard line to remove health care dollars from the province of Nova Scotia, Mr. Speaker. Mr. Speaker, can the Premier stand in his place and confirm with us what specific requests he's made of Prime Minister Harper when it comes to addressing some of the unique challenges Nova Scotians face with delivering our health care?
Honourable the Premier.
Mr. Speaker, at absolutely every opportunity we have raised this in every forum, whether it is the Healthcare Ministers Forum through our Minister of Health, through my chairmanship of the Council of the Federation, we have brought it up. When I have met directly with the Prime Minister, I have addressed the question of healthcare transfers with him, because we are concerned that there will be a diminished ability of the province to be able to respond to healthcare concerns in the province. I might point out, a lot of this has to do with the fact that the system is so laboring under the intense damage that was done by Liberal governments back in the 90s when they stripped out the money in healthcare, when they laid off nurses, when they closed down beds, Mr. Speaker. The last time...
Order. Now you know why we take such a long time to get so many little questions through in question period. When the Speaker says order, that means order. So I'd ask the honourable members to quit after the Speaker says order with the chatter. Thank you. The Honourable the Premier, on your answer.
The last time the Liberals were in power in this province, Mr. Speaker, they wreaked such havoc and damage on the healthcare system that after 15 years we have still not recovered.
The Honourable Leader of the Progressive Conservative Party.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the Minister of Health. The Auditor General reported today that the Health Department budgeted $0 for health equipment this year, a fact that just defies common sense. Mr. Speaker, and as a result, the department has had to raid its own emergency fund to pay for health equipment needs across our health system. My question for the minister is a simple one. What programs is the emergency fund usually used for?
The Honourable Minister of Health and Wellness.
Yet again, Mr. Speaker, it's just not true what the minister or member opposite is talking about. We've invested in equipment throughout the province, Mr. Speaker. I just recently traveled to Yarmouth to see some of the latest technology in the lab section of the hospital, Mr. Speaker. An investment made with this government's approval, Mr. Speaker.
The Honourable Leader of the Progressive Conservative Party on his first supplementary.
Mr. Speaker, just for the benefit of the minister, I will table the section of the Auditor General's report where he criticizes the minister's department for having $0 allocated to health equipment and for raiding the emergency fund for just that purpose. But, Mr. Speaker, it's not the only example. Ernst & Young was commissioned by the department a year ago, a $100,000 report that found $52 million in cost savings in administration in the Department of Health. but the department rejected 80% of those savings, $43 million in potential money for frontline care that the department rejected in favour of its own bureaucracy. Today, we learned there's another $3 million that the department could save that they've rejected in favour of their own bureaucracy. Mr. Speaker, my question for the minister is, why does he consistently reject cost savings that could actually go into improving health care in the province?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker, and it's very confusing listening to his answer. The one thing, and I think I said it earlier, the one thing we have rejected is the way the former government provided healthcare service here in Nova Scotia, Mr. Speaker. What we've rejected is the way they've invested in Nova Scotia, especially in healthcare, Mr. Speaker. We are working extremely hard over the last 3 years to ensure that we continue to invest in healthcare services. No question, I would love to do more, Mr. Speaker. This government would love to do more, but we've been shackled by decisions from the past that have created the mess we have now, Mr. Speaker. Not only the financial mess, but the model of care that we have in health care, Mr. Speaker. We are working extremely hard to ensure that Nova Scotians have access to health care services, that we provide the capital grants to ensure that they have the product and the services and the equipment that they need, Mr. Speaker. It's because of the former government we're in the mess we're in now. We're going to clean it up.
The Honourable Leader of the Progressive Conservative Party on his final supplementary.
Mr. Speaker, what the minister is confused about is that he is the minister of the department today. It is his government that is responsible for health care now. But perhaps, Mr. Speaker, if you had nothing good to say about your own administration, you would have to reach back as far into the past as possible to come up with an answer. That's the problem with this government, Mr. Speaker. $3 million a year that could go into health care today. $43 million that could go into health care, according to Ernst & Young. Rejected by his department. Rejected by that minister. The Auditor General points it out today, so I will ask the minister to set it right. Will he now commit to implementing all the projects that Ernst & Young identified and the Auditor General identified and put that money back out of administration and into frontline health care?
Honourable the Minister of Health and Wellness.
Thank you, Mr. Speaker. As I said in my previous answer, we're working extremely hard with the district health authorities, but we're also working extremely hard with the volunteer boards from those district health authorities, Mr. Speaker, because they recognize the importance of what the needs are in the communities that they represent. Something that if the member opposite had his choice, Mr. Speaker, would get rid of our volunteer boards across the province, Mr. Speaker, and you only make decisions out of Halifax. But that's not the direction this government's going to take, Mr. Speaker. We're working through merged services to reduce administrative costs in healthcare system so that we can redirect that to the frontline healthcare services, Mr. Speaker, something that former government didn't do.
The Honourable Member for Glace Bay.
Thank you, Mr. Speaker. This government has handed $590 million, taxpayers' dollars, to 6 large corporations. All that money, and now there are more Nova Scotians unemployed than during the recession. The NDP was not always so fond of such corporate handouts, Mr. Speaker. On October 20th, 1999, the now Deputy Premier said, quote, "You should be ashamed that so much money is going out to a corporation that can darn well afford to do this on their own. But if you want to dole it out to your buddies, you should be ashamed of yourself. Your leaders should be ashamed, and your whole government should be ashamed." End quote. So my question to the Premier, if this government thinks they are fair-minded, I will ask the Premier, why is he handing out money, hand over fist, to corporations while taking dollars out of the classroom?
Honourable the Premier.
In fact, Mr. Speaker, the per capita funding for students in this province has actually gone up. It's the highest that it has ever been in this province, Mr. Speaker. And the reality is that the investments that we are making are ensuring that there are more jobs in Nova Scotia, that there's actually an opportunity for young people to be able to stay in Nova Scotia, to make their lives here. Mr. Speaker, just as an example, the assistance in Irving Shipyards was was made, because without it, we would not have won that contract. That means some 10,000 jobs, many of them for skilled tradesmen in the shipyards. That means a future. That means a career for many, many young people in this province. If the member from Glace Bay had his way, Mr. Speaker, there'd be jobs down on the waterfront, but they would be building condominiums.
Hear, hear. The honourable member for Glace Bay on his first supplementary.
Okay, Mr. Speaker, I'm not sure what that means, so I'll move on. On November 24th, 2000, the now finance minister said, "We have no difficulty as a province. Previous governments and this government have no difficulty giving millions of dollars to profitable companies and corporations as a first priority," end quote. Then the current member for Halifax-Shabukto added, "These are, quote, these are public dollars. These are dollars that the government administers on a trust. They are not dollars that are simply to be giving away," end quote. $590 million to 6 companies, 1,300 layoffs, Mr. Speaker, and there are more unemployed than during the recession. Clearly, this government is giving away money and harming public trust. So my question to the Premier, with cuts to education and health care, and with more unemployed now than during the recession, why has this government prioritized corporate handouts?
Honourable the Premier.
Actually, Mr. Speaker, I just correct what the member had to say. In fact, the amount of money going into health care has actually increased by $100 million. The simple fact of the matter is that the per capita student funding is at its highest level in history. As I pointed out, the $300 million in Irving was a commercial loan for which they can earn forgiveness, but only if we have received some $2 billion in increased tax revenue to the province. So this means that there will be $1.7 billion more that can go into health, education, roads, all of the other services that we provide. Now, I know he said he didn't understand what I meant by the fact that there would be building condominiums down the waterfront. That is because, Mr. Speaker, if he had his way, the shipyards would be closed.
The honourable member for Glace Bay on his final supplementary.
Thank you, Mr. Speaker. This government has failed to create good jobs that have promised Nova Scotians to the tune of 2,200 new jobs per year. This government gave $590 to 6 large corporations, and resulting in 1,300 net job losses. That money went to those corporations. That money stayed in their coffers, Mr. Speaker. It didn't create jobs for the people of this province. We were told the $590 would create more than 15,000 jobs, but there have been 3,400 full-time layoffs since this government took over in 2009. $590 to 6 large corporations. What did it get us, Mr. Speaker? Layoffs, bankruptcies, and closures. Great for big business, but bad for the Nova Scotia taxpayer. So my question, as the member from Halifax-Shabukto once asked, will the Premier, quote, explain to this House what his government intends to do now that his government handouts have actually brought fewer jobs, end quote.
The Honourable Premier.
Mr. Speaker, it's so disappointing that the member would attack companies, attack the government that's actually creating jobs in Cape Breton, like IBM, who's going to have employees there, Mr. Speaker, and right across the province, creating jobs in communities like Shelburne, in Digby, of course, many of those in the region of Halifax. Mr. Speaker, I want to make this very simple point and see if the member for Glace Bay can understand it. After the greatest recession since the Great Depression, the unemployment rate in Nova Scotia is lower now than at any time that the Liberals were in government the last time. At any time.
The honourable member for Argyle.
Thank you very much, Mr. Speaker. My question is to the Minister of Health. Electronic medical records is an important program that needs to continue to expand across the province outside Halifax. But the serious risk to privacy of information identified by the Auditor General today needs to be addressed first. Nova Scotians, of course, should be concerned about how their information is being handled and the privacy of it. Neither Capital Health Authority or the WK have tested its disaster recovery plan for their data center or provided training to staff about how to implement during a time of crisis. Mr. Speaker, how can the minister justify this serious lapse of safety of patients' information, and will he ensure the people's private information is safe?
The Honourable The Minister of Health and Wellness.
Thank you, Mr. Speaker, and I thank the member for his question. No question, we take privacy and confidentiality very seriously, Mr. Speaker, and so do our colleagues in the district health authorities across the province. We welcome the recommendations that are made through the Auditor General around the information system to improve it, and we're working with not only Capital Health and the IWK, but all our district health authorities to ensure that patients in Nova Scotia can have confidence in the IT security that we have when it comes to patient records, Mr. Speaker.
The honourable member for Argyll on his first supplementary.
Mr. Speaker, the NDP's priorities were clear from the last budget update. On page 5, it states a land purchase of $20 million for New Page is almost entirely offset by reduced capital spending by the Department of Education for school construction and renovations and by the Department of Health and Wellness for IT projects, and I'll table that for the House. The NDP chose to move $20 million from school construction and the Health Department IT projects that are now in question today, and it used that land or that money to purchase land from New Page. Mr. Speaker, why are multi-million-dollar handouts of a higher priority for this NDP government than patient privacy?
Great question.
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker, and that's quite a stretch, the member opposite, trying to connect those two. The Health Department takes it very seriously, the privacy and confidentiality of the information that our clinicians, our doctors, our nurses, our paramedics receive while they treat individuals here in Nova Scotia, Mr. Speaker. And we're going to continue to work with our district health authorities. We're going to continue to work with Capital District Health Authority, the IWK, to ensure that any improvements that we need to make will take place, Mr. Speaker. And I'm remiss not to mention it again, that I sit up at night, Mr. Speaker, wondering what we could have done with an extra $80 million because of the mismanagement of the Colchester Hospital from the member opposite, Mr. Speaker, when they were last in government.
The honourable member for Argyll on his final supplementary.
Thank you very much, Mr. Speaker. And I'll remember the words of the Minister of Health when it comes to the people of Truro and Bible Hill and Colchester County when they said they didn't need a hospital. So I'll remember that, Mr. Speaker. The Auditor General found a lack of documentation, training, and testing at Capital Health and the IWK. He suggested password settings had poor controls and permit the use of weak passwords, and the Auditor General was able to break into 363 out of 2,065 records with just generic software that you can found on the internet. In some cases, past employees still had access to health records. So my question to the through you, Mr. Speaker, to the Minister is how can the Minister justify not putting patients first at the cabinet table and not fighting to protect their privacy when the decision was made to move $20 million from health IT projects to purchase land from New Page?
The Honourable Minister of Health and Wellness.
Mr. Speaker, no question, I was glad to hear that the Premier and the member from Truro Bible Hill were at the launch of the new hospital in Colchester, Mr. Speaker. No question, we support the people of Colchester County, Mr. Speaker. That's why we continue to invest in it. What they want from their government is to be honest and upfront and truthful, Mr. Speaker, when you tell them how much something's going to cost, Mr. Speaker. They want that from their government, and that's what we're going to do, Mr. Speaker. That's why one of the first pieces of legislation the former minister brought in once we took over government, Mr. Speaker, was directly address the privacy concerns around health records here in our province, Mr. Speaker. I want to thank the former minister for doing that. It was something that was needed in our province to ensure the security and the confidentiality of patient records in this province, Mr. Speaker, and we look forward to that piece of legislation fully taking place here in Nova Scotia for all Nova Scotians to have confidence in the IT information that we have.
The honourable member for Glace Bay.
Thank you, Mr. Speaker. The Premier just signed a deal to subsidize an out-of-province company to compete directly with Nova Scotia businesses. This money is on top of $590 million given that this government has given to 6 corporations to lay off 1,300 Nova Scotians. On April 26, 2005, the member for Halifax Fairview said, quote, "All they want from this government is for this government to get out of their way. Stop subsidizing their competitors and let them hire Nova Scotians," end quote. The same can be said for consulting engineers, Mr. Speaker, in the government's deal with Editown firm projects. Mr. Speaker, my question for the Premier is this. If the NDP thought a previous Conservative government should, quote, "get out of the way," end quote, why is this government interfering so heavily?
Honourable the Premier.
In fact, Mr. Speaker, this situation couldn't be more different. The reality is that this is work that this company has that is being done in Alberta. They had a choice. They could hire Nova Scotians and have them work in Alberta, or they could hire Nova Scotians and have them work in Nova Scotia. And frankly, Mr. Speaker, we'd rather have them work here.
The honourable member for Glace Bay on his first supplementary.
Mr. Speaker, the consulting engineering sector in Nova Scotia is a vibrant, growing sector, and their biggest challenge is not contracts. It's attracting and retraining good quality employees, good quality engineers, and this is going to be a problem if a company subsidized to compete against them, Mr. Speaker. On November 24, 2000, the now Agriculture Minister said, quote, "The Minister doesn't realize what an unequal playing field he creates when he gives preferential treatment to some people in this province and not to others," end quote. The same could be said for consulting engineers, Mr. Speaker. This industry was already highly successful in hiring Nova Scotians without government assistance. The government decided it wanted headlines and jumped into the industry, and the Premier's need for attention put Nova Scotian companies at a very competitive disadvantage. Mr. Speaker, my question for the Premier, why is the government competing against local entrepreneurs who are in the same business as projects?
The Honourable the Premier.
Mr. Speaker, what Projects has agreed to do, of course, is to hire new graduates from our engineering schools around the region. This will be an opportunity not only for them to bring home people from other parts of the country, but also to employ young graduates from our engineering programs who are going to be able to stay in Nova Scotia, live here, to put down roots here. Mr. Speaker, this is going to be good. It actually is going to strengthen the market for all of the consulting engineers. It's going to bring more people into the market. In fact, Mr. Speaker, Projects indicated, I believe, that they have already received some 1,200 applications for the jobs in Nova Scotia. I believe 700 of them were from other parts of the country. Mr. Speaker, this is the problem for the member for Glace Bay is that this is really good news for Nova Scotia, and they just don't like good news.
The honourable member for Glace Bay on his final supplementary.
Mr. Speaker, on May 14, 2008, when referring to companies that come to Nova Scotia for payroll rebates, the member for Halifax-Shabukto said, quote, "That's a company that doesn't necessarily want to be in Nova Scotia. They come here for the subsidies. That's not the best use of public dollars," end quote. Mr. Speaker, when your Premier rants about the message we send to business, we worry about the message your Premier's actions are sending to business. $590 to 6 corporations who laid off 13 Nova Scotians. This Premier's actions are telling business around the world he's willing to cut them a big check and that companies can threaten this government and get millions in subsidies. So my final question to the Premier is very simple. How many employees have been lost from existing consulting engineering firms and hired by Projects?
Honourable the Premier.
Mr. Speaker, what we're seeing is a very healthy market in the province for engineers. That's going to get even better over the years to come. But I'd like to address something that the member keeps doing. He keeps talking about, less jobs, people leaving jobs. Simple fact of the matter is just this is the way this works, Mr. Speaker. Had we not, for example, supported Port Hawkesbury, that community would have lost $160 million a year in direct investment in that community, Mr. Speaker. And Speaker, the number of people working in Port Hawkesbury paper would be zero. The number of people associated with the forestry industry would be so greatly diminished. So, Mr. Speaker, these investments support communities. They create work for people throughout the sector. Mr. Speaker, if they had their way, they would walk away from Port Hawkesbury, they would walk away from the street, and they would simply say to them, "You are on your own."
The honourable member for Cape Breton North.
Thank you, Mr. Speaker. Mr. Speaker, my question is the Minister of Education. Mr. Speaker, education is the key to a confident, bright future for our young Nova Scotians. Canadians like me who support children with special needs were pleased by the judgment unanimously passed by the Supreme Court of Canada this month related to special education funding for a dyslexic boy in BC. Advocates for the disabled said school boards that cannot furnish compelling evidence to justify underfunding must henceforth provide genuine help to children with learning disabilities. So my question to the ministers, will the minister accept that she must enforce the law of the land and that she cannot justify underfunding help to children with learning disabilities?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. Thank you for bringing that very important topic here today. It's very important that we support all of our students, and we have a number of students in our system that have learning challenges. And I am very pleased to say that our government supports the needs of our students that have very specific learning needs by increasing the budget for our special needs students, and we have protected that funding. And earlier today I did have a meeting with someone in our department to see how things were going across school boards and to make sure that our students are getting the supports that they need, and I am getting positive comments from the school boards at this time. Thank you.
The honourable member for Cape Breton North on his first supplementary.
Mr. Speaker, adequate special education is not a dispensable luxury for those with severe learning disabilities. Judge Alba said that with a 9-0 majority. The lawyer for the family of the dyslexic boy who brought this to the Supreme Court of Canada said the decision sets a national precedent and sends a message to all public schools. This is a warning to them that they have to comply with their duties under the Human Rights Code to have ensured that students with learning disabilities have the same access to education as other students. So my question is, will the minister accept that special education is not a dispensable luxury and that she cannot justify underfunding help to children with learning disabilities?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. There have been a number of things that our government has done to ensure that students with very specific learning disabilities are able to have supports outside of our regular school system. It's very important that we support all of our students, and especially our students with significant learning disabilities. We brought in Succeeding in Reading so that we're able to be in at the primary level to be able to pick up any significant problem a child is having with learning to read. You are absolutely right, Mr. Speaker. I'd like to say to the member opposite, this is very important, and this government is supporting our students with significant needs with their learning. Thank you.
The honourable member for Cape Breton North on his final supplementary.
Mr. Speaker, we brought that question up in the last session about transitional support funding for students outside the school system, as she talked of. In my opinion, this may be the most important human rights case in a decade or so, said Dr. McKay, Dalhousie University law professor. This minister does not provide adequate funding for our special needs students. As we found out in budget estimates, the minister considers special education an expensive luxury rather than a basic human right. So my question is, will the minister take action to safeguard the human rights of children who need supports to succeed and help children with learning disabilities?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. I have to say that I'm offended by saying that anyone would consider that I would think that providing supports to our students is a luxury. It is a necessity that we are, and we have the responsibility as government to provide for all of our students, especially our students with special needs. Mr. Speaker, we are absolutely making sure that we are doing the very best we can to support our students. It is not a luxury, it is our responsibility.
The honourable member for Dartmouth East.
Thank you, Mr. Speaker.
Now I want to listen to this.
My question is for the Premier. The Premier often expresses concern that when members of the opposition, or frankly anybody else, business community, the media, anybody, quote him directly from Hansard or from news stories, he says that isn't actually what he said. So, Mr. Speaker, I want to start by quoting from Hansard of last week. November 15th, not 11 years ago, not 10 years ago, not 20 years ago, last week, and I just want to know if the Premier feels that the Hansard record of what he and I said is accurate. So, Mr. Speaker, as part of another question, I said, quote, the NDP came to power promising frozen tuition, end quote. The Premier responded by saying, quote, the simple fact is when we came in, we never said we would freeze tuition fees. It's something we did not say, end quote. And I will table that from Hansard. Does the Premier agree that that is what he said last week?
Honourable the Premier.
I absolutely do, Mr. Speaker, and that's absolutely true. The simple fact of the matter is that we laid out very clearly in the last election what our commitment would be on student funding. It was part of the commitment that is crystal clear. It's part of the checklist, Mr. Speaker, and he can check it.
The honourable member for Dartmouth East on his first supplementary.
Well, Mr. Speaker, then I guess I'll ask the Premier to explain another quote that appears on the NDP party website, the Premier's own biography, currently. It appears on the NDP party website in his biography, and I will quote from that, Darrell supports a tuition freeze as the first step in making sure that all young Nova Scotians have equal access to post-secondary education. And I will table that. So, Mr. Speaker, can the Premier explain why his party says that he supports a tuition freeze as an important part of accessibility, but he says that he doesn't support a tuition freeze?
The Honourable the Premier.
Mr. Speaker, the simple fact of the matter is that tuition in this province is actually going down relative to the national average, Mr. Speaker. That is the truth. And in fact, when we came to power, there was the end of the federal program meant that we had to start in this province by backfilling some $30 million in federal money that was going out the door. Had we not done that, Mr. Speaker, not only would tuition fees be going down as opposed to the national average, they would have gone up by some 15 to 20%, Mr. Speaker. We brought in the new graduate tax rebate. We brought in the cap on student debt. Mr. Speaker, we have done more on student assistance than any government in history, with the exception of the advent of the student loan program.
The honourable member for Dartmouth East on his final supplementary.
Mr. Speaker, the Premier can try and confuse the issue as much as you want. The question was really quite simple. He said last week, and he agreed, he said it, that he did not advocate for a tuition freeze, yet the party's own website to this or at least till yesterday, maybe they've taken it off now during question period, but as late as yesterday, and the time and date are on there, said that this Premier currently supports a tuition freeze. So, Mr. Speaker, he's blamed the opposition for misquoting him. He's blamed the media for misquoting him. He's blamed the business community for misspeaking. Mr. Speaker, is the NDP party right about what the Premier stands for, or is he right, or doesn't he know?
Honourable the Premier.
No, Mr. Speaker, what I would like to advocate, in fact, is for lower tuition for all of our students. In fact, what we would like to do is reduce student debt even further. What we would like to do is to make sure that as many people as have the capacity and capability to go to university or community college go, Mr. Speaker. Those are the things that we advocate for, Mr. Speaker. But we're in government. We got to make sure that we have the money to pay for it, and that's what we're doing. We're balancing all the needs of the students, the needs of seniors, the needs of the healthcare community, the needs for economic development. Mr. Speaker, that is the responsibility of government. I know that's something that they have no experience in.
The member for Glace Bay.
Thank you, Mr. Speaker. And my question is for the Minister of Health. Late last month, 6 councillor attendants working in addictions and mental health within the Cape Breton district were issued layoff notices effective January 1st, 2013. With a combined total of 95 years' experience, these 6 valuable team members were told the delivery model of care would be changing and their skills were no longer needed. My question for the Minister, does the Minister feel these layoffs will somehow improve treatment for the 250 people who need their help?
Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker, and I thank the member for the question. No doubt, we're always cautious and concerned whenever there is a reduction of employment for anybody in the province, Mr. Speaker. We recognize that. But one thing we did know after coming into government, Mr. Speaker, is that we went out and we consulted within the mental health and addiction field, Mr. Speaker, with partners, and we produced the first ever of our province, Mr. Speaker, a mental health and addiction strategy. And no question, with that strategy comes a change of model of care. And it's unfortunate that this does affect a small number of healthcare workers in this province, Mr. Speaker. But I do believe with the change in model of care that services that will be provided will meet the needs and better meet the needs of those who are seeking services within addiction services.
The honourable member from Glace Bay on his first supplementary.
Thank you, Mr. Speaker. And as I know the minister is very aware, there's no one-size-fits-all treatment when it comes to treating addictions. This is why it's important to have a number of tools available to us when it comes to treating these very devastating and dangerous addictions for families and those who are addicted. Mr. Speaker, it's important to support Talbot House and its model because it works for some people. It's important to have appropriate treatments available when and where they are needed because that works for others, Mr. Speaker. And it's important to acknowledge that counselling is a vital part of treating addictions because, again, counselling works in some cases. Holistic treatment options work and they need to be embraced. So having said that, my question to the minister, does he support an entirely medical-based treatment program for addictions?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker, and I do appreciate that question. No question, as a former paramedic, as a frontline healthcare provider, I recognize the importance of delivering healthcare services. And when we made the decision to bring over recovery houses into the Department of Health, one of the first things I did say to some of those who were running those addiction recovery houses, Mr. Speaker, is that I appreciate the work they do and the model care that they provide individuals. No question, I think we need a suite of options in Nova Scotia to address addiction services. We can't just have one type of service, no matter what we're talking about in healthcare, but especially in addiction services. So I support, no question, a suite of options for Nova Scotians who are seeking help when it comes to addiction services.
The honourable member for Glace Bay on his final supplementary.
Thank you, Mr. Speaker. A rally was held earlier this month outside the Cape Breton Regional Hospital. At that rally, Noelle Guthrow, a registered nurse, was interviewed by the Cape Breton Post, and she said, and I quote, "The counsellors are essential to this unit. When the clients come in, they look for the counsellors immediately. It's a tremendous support for them. The clients are the ones who are really going to be affected," end quote. Mr. Speaker, this isn't a statement made by councillors to protect their jobs, and it's certainly not a statement made by myself to stand in my place and ask this question. The statement comes from a registered nurse who works in the Addiction Services Unit and who sees the beneficial role these councillors were playing in helping patients overcome their dangerous addiction. So my question to the minister, will he consider maintaining the councillors outside of the new model of care so patients can still access this important support?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. No question, as Minister of Health, one of the things you have to do is rely on those professionals who are out providing those services, Mr. Speaker. And as I said earlier, we did do a wide consultation throughout the province around mental health and addiction services, and we take that information back, and the former minister and myself take that information and we take advice from those professionals. Even though I have a background in healthcare, Mr. Speaker, I'm not a professional when it comes to addiction services or what is in the best interest of those. So we rely on that information from those individuals who are experts, Mr. Speaker. And the advice to the department, to the government, to myself, is that this model of care that we're implementing now will better serve those individuals here in Nova Scotia who have addiction issues, Mr. Speaker. And I hope that we'll see that as we unroll the new model of care in Cape Breton and across the province, that those services will be enhanced by the model of care that we've chose to take, Mr. Speaker, when it comes to addiction services.
The honourable member for Dartmouth North.
Thank you, Mr. Speaker. Today my question is for the Minister of Service, Nova Scotia and Municipal Relations. Today there was an announcement by the Minister of an additional $400,000 the government will provide to the Salvation Army Good Neighbour Fund. And Mr. Speaker, that is welcome news for those families who struggle, obviously, through the winter heating months. Mr. Speaker, that program, as we know, only allows certain people to qualify based on income levels and how many times over the years they have used it. Mr. Speaker, last year, the funding that the government provided to the Good Neighbour program ran out very early. And I want to quote from a press release dated February 24th from the Minister. Given though the province removed the provincial portion of the HST from home heating oil, and even with the help from the Heating Assistance Rebate Program, some families are still finding it difficult to afford to heat their homes. And I'll table that, Mr. Speaker. Mr. Speaker, my question to the Minister, seeing that last year's program ran out of funding and an additional $400,000 was offered, is the Minister prepared to write an additional cheque, seeing that the power rates are going up in January this year?
The Honourable Minister of Service, Nova Scotia Municipal Relations.
Thank you, Mr. Speaker, and I thank the member for my one and only question so far in this sitting of the House. So certainly want to get it right. The member raises a really important issue, and I guess evidence of our concern was today's announcement of giving $400,000 to the Salvation Army for their fund. At this point in time, we're not thinking of giving another $400,000. I will tell them that. The money that we used last year with two donations of $400,000, that comes out of our Heating Assistance Rebate Program. So we will look to the future. We'll see what the uptake on the Heating Assistance Rebate Program or HARP program is, but at the present time, we made no commitment to the Salvation Army that we'll give an additional $400,000.
The Honourable Member for Dartmouth North on his first supplementary.
Thank you, Mr. Speaker. There's another local agency and organization here in Metro. It's Parker Street Furniture Food Bank, run by Mel Boutler, and we're all familiar with Mel and the efforts that he makes in helping families throughout HRM pay for heating costs and electricity costs. I'm wondering today if the Minister can tell me if he's entertained a conversation with Mr. Boutler in regards to perhaps having some funding extended to that organization to help with families' heating bills recently, or would he entertain one?
The Honourable Minister of Service, Nova Scotia Municipal Relations.
Thank you, Mr. Speaker. I thank the member for the question. And this is, I think, is an issue that was raised last year as well. I have not had any discussion with Mr. Boutler. I think our thought is there are a number of organizations, I believe, who would like to have funding from the province, and I think some of you indicated that maybe part of the $400,000 should go to them. So at this present time, I have to say we have a fair regard for the Salvation Army and how they administer their fund, and the fact that they have such broad coverage across the province. Most other organizations are very local, to a particular area, but the Salvation Army has a much broader sweep, and so we feel that that's probably a more appropriate organization just because of its broader reach across the province. And so I would say certainly for this season, I'm not anticipating a change in who we direct those funds to.
The Honourable Member for Dartmouth North on his final supplementary.
And Mr. Speaker, I do too recognize the efforts of Salvation Army, the assistance that they provide my office with helping families in Dartmouth North. And I want to say that I look forward to this coming season as well with the program. In keeping with the comments of the Minister, Mr. Boutler does reach out to a number of individuals, and not just in HRM. We brought him a number of cases throughout the province as well, and I want to thank him. I think it's an opportunity for you as the Minister to sit down and fully discuss the extent of his program. Keeping in mind your quotes from last year's press release around the HST rebate not totally affecting or having the positive effect on a lot of families, keeping in mind the 2,000 families plus that the Salvation Army program affected last year. That being said, there's a number of individuals who are still going to struggle this coming heating season with home fuel and with electricity. My question to the Minister, Mr. Speaker, is has he and his government considered a direct program that would support and target specifically low-income families and seniors on fixed incomes?
The Honourable Minister of Service, Nova Scotia Municipal Relations.
Thank you, Mr. Speaker. I don't want my comments to in any way be seen as not valuing the work of Mr. Boutlier and his organization, or any other organization who works hard to look after the most vulnerable in our society. And I would like the member to also take back with him my concern as minister, and I think of this government for trying to reach as far and as wide as we can for anyone and everyone who has a particular need. That sometimes our programs, sometimes it's, I think, really difficult to design a program that, number one, that gives the broadest reach that you want, but in some way you could try to make it accountable for the taxpayers whose money you're using to support it. I think I would always be open for some way to tweak a program that could possibly make it better, reach farther, do whatever. But I don't want to mislead anyone that my comments would make them think that somehow I'm going to open the vault in a much broader way. I don't feel that I have the capacity, and I want Mr. Boutlier to think that I might. And so I'd be glad to meet with him and have a chat about his program. Hello. But at present time, I would say we're going to stick with the program we have. But if it's possible to have a dialogue with him, I'd look forward to that.
Thank you. The honourable member for Kings West.
Thank you, Mr. Speaker. Just 10 months after the brand name version of OxyContin was removed from circulation, Nova Scotia is in many ways back to the drawing board. With the federal minister's approval of the generic form of OxyContin, it will be only a matter of time before the number of prescriptions rise for the soon-to-be available generic. Earlier this year, the Minister of Health and Wellness of the day issued a press release removing OxyContin and OxyNeo as a benefit under the formulary and listing OxyNeo as an exception status drug for the purpose of prescribing. Mr. Speaker, I will table this release. Could the Minister please confirm whether he plans to keep these same restrictions on the generic version of OxyContin?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker, and I appreciate the question. I don't agree with the member when he says we're back to square one, because we've worked extremely hard over the last number of years to put in controls, put in services, and work with our partners when it comes to addiction, especially around opiates here in Nova Scotia. We recognize it's a serious issue, not only here in Nova Scotia, across the country. That's why, as I was pleased to have the chair of the Ministers of Health meeting here in Halifax this summer, and that's why I was pleased to have all health ministers, including the minister from Quebec, agree to ask the federal minister to hold off approval of the generic form of OxyContin. No question, I can tell the member I was disappointed with the announcement of the federal government not living up to that and going ahead with approval of that. We're going to continue to work here in Nova Scotia with our partners in law enforcement, our partners with the College of Physicians and Surgeons, with the members of their staff and students at the medical school, and our pharmacists, to ensure that we don't see what we've seen in the past when it came to abuse of OxyContin in our communities across Nova Scotia.
Honourable member for Kings West.
Mr. Speaker, we were all disappointed with the federal minister's decision. However, her inaction does not mean this minister can absolve himself of his responsibility. This minister has choices. He can ensure every health care partner is doing their part to stop the scourge of abuse related to prescription drugs. He himself can take an active role in reducing prescription drug deaths, and there have been 269 in Nova Scotia in the last 5 years alone. Or he can point fingers. Could the minister please indicate whether he has advocated to his federal counterparts that all opioids, including their generic versions, be tamper-proof before they are approved in Canada?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. And unfortunately, I don't think that may do any good, as we've seen with the most recent announcement on behalf of the federal government. No question, Mr. Speaker, we continue to work with our partners. We have a unit from Dalhousie that goes out and educates and hopefully works with, not hopefully, I know they work with physicians across the province, Mr. Speaker, ensuring that they have the most up-to-date information around the use of opiates, for example, for any of their patients that comes in. But we also have to recognize that there is a role for pharmaceuticals play in healthcare services and opiates, Mr. Speaker. We need to make sure we have the controls in place, like the prescription monitoring program that I'm glad to say that we extended to 24 hours, 7 days a week earlier this year, Mr. Speaker. There's another tool that not only law enforcement but pharmacists and physicians use to try to curb the abuse of prescription drugs, Mr. Speaker. So we'll continue to work with our partners. We'll continue to work with clinicians within the healthcare system to move forward on any approval of any medication on our formularies here in Nova Scotia, but more importantly, to try to address and not have what we've seen in the past when it comes to the addiction of opiates like OxyContin, Mr. Speaker.
The honourable member for Kings West on his final supplement.
Mr. Speaker, I will reiterate the role and responsibility of this minister to ensure he is doing his part to stop the scourge of abuse of prescription drugs, not just step back. Earlier this spring, the Auditor General issued 17 recommendations to address a prescription drug monitoring program. According to the AG's statement, around the prescription monitoring program, significant weaknesses in control and monitoring processes open the possibility that misuse or abuse of monitored prescription drugs continues undetected. Could the minister please provide an update as to where we are when it comes to improvements in monitoring and control systems and in the development of more responsive online technology that will better track prescriptions, since we don't have a just-in-time system?
Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. Thank you for the question. We're working extremely hard with our partners. As I mentioned earlier, just by extending the availability of the prescription monitoring program, Mr. Speaker, to our partners, that helps to one aspect of dealing with this issue, Mr. Speaker. There's many more that we need to continue to work with. And one of the number one ways we can ensure that we can tackle this issue in our communities across the province, Mr. Speaker, is to discuss it, to ensure, especially our young people, recognize the dangers of mixing prescription drugs and alcohol, for example. We know with recent deaths in our province, Mr. Speaker, they seem to be around those young university-age individuals, Mr. Speaker, people who don't have an addiction problem, Mr. Speaker. So not only do we got to support and provide services to those who find themselves addicted to opiates or other pharmaceuticals, Mr. Speaker, we have to educate our young people and all Nova Scotians, for that matter, Mr. Speaker, on the importance of not mixing pharmaceuticals and alcohol, for example, Mr. Speaker, because there's a danger in that where you can ultimately, by taking one pill, Mr. Speaker, die from that result.
The honourable member for Kings West on a new question.
Thank you, Mr. Speaker. Mr. Speaker, the province embarked on a $75 million project to provide complete access to high-speed internet across the province. Yet it is well known in rural communities there are still many Nova Scotians without this access. My question for the Minister of Economic and Rural Development and Tourism: will the minister tell this House how many Nova Scotians are currently without access today, and when he anticipates that all Nova Scotians will be hooked up to high-speed internet service?
The Honourable Minister of Economic and Rural Development and Tourism.
Thank you, Mr. Speaker. Mr. Speaker, I've got to say that in the province of Nova Scotia, we are one of the most connected jurisdictions around the world. And unfortunately, Mr. Speaker, as much as we would like to see everybody have access to high-speed internet, I can stand here in my place and say that the number without it is considerably less than 1,000.
Thank you. The honourable member for Kings West on his first supplementary.
Mr. Speaker, lack of access to high-speed internet is not simply an inconvenience. For some, it is a detriment to business and is affecting local economies in rural Nova Scotia. Mr. Michael Innes has been struggling to connect to high speed for over 3 years now, and his frustration level is reaching its peak. Connecting to dial-up in order to check email for his business takes on average 20 minutes or more. During the time when he is connected, he can't even answer his telephone. If he's on the internet for 20 minutes or 2 hours to try to retrieve information, he cannot receive calls from clients. My question for the Minister, Mr. Ennis has contacted the Premier passed him on to the Minister passed him on to the Department official. What actions will this Minister take to ensure that Mr. Ennis and all remaining Nova Scotians are connected without further delay?
The Honourable Minister of Economic and Rural Development and Tourism.
Yeah. Mr. Speaker, right now, as we speak, the broadband is available to 99% of Nova Scotians in the province of Nova Scotia. When anyone calls, whether it be the Premier's office or my office or the broadband, we act accordingly. We get back in touch with them. The service provider, and I think the gentleman that the member is referring to, the service provider is Eastlink. We are working with Eastlink to try to complete, we're at 99%, Mr. Speaker. It's not a bad thing, but still, Mr. Speaker, for this government, it's still not good enough.
The honourable member for Kings West on his final supplementary.
Mr. Speaker, for a business, when your competitors all have access to high speed and you do not, it is a serious impediment. This issue is a serious concern for many Nova Scotians. It has been and continues to be a source of great frustration. Nova Scotians are asking this government for an indication on when there will be full high-speed connectivity. My question to the Minister, what steps is the Minister taking to ensure the remaining Nova Scotians have access to high-speed internet without further delay and not up to 2014, as he has indicated in some of his recent correspondence?
The Honourable Minister of Economic and Rural Development and Tourism.
Mr. Speaker, we inherited a situation where the previous government made a commitment to have high-speed internet through the service providers in the province of Nova Scotia. There was a time frame that was under the terms of the agreement that was set to meet that condition. We continue. We had a meeting as recently as yesterday with Eastlink. We understand, we appreciate, we will endeavour to make sure that Eastlink fulfills their obligation for high-speed internet in the province of Nova Scotia.
The honourable member for Inverness.
Mr. Speaker, my question is for the Minister of Transportation. Independent Nova Scotian truckers make a valuable contribution to our economy. They provide cost-effective delivery of services to fix and build our roads. For maintenance, and now with the government's new paving plant, this government is choosing to do trucking internally at a cost of $84.88 per hour per axle for a 10.6-ton load, when it could be paying independent truckers $59.67 for a 16-ton load. Can the minister tell us how this government expects to pave more roads when they're paying 40% more to haul 30% less?
The Honourable Minister of Transportation and Infrastructure Renewal.
Thank you, Mr. Speaker, and I thank the honourable member for the question. I will start by saying we actually are paving more and paying less. And that is basically because of what we are doing with our chip sealing and our asphalt plant. In terms of the specifically with reference to the trucking, As the member will know, we have depots that have trucks that are used up until now, in part seasonally, plowing and that sort of thing. We've been able to use some of that equipment now through this time of year during the paving season as well. So we're taking idle equipment and we're using it. That is an advantage to the province, and we're going to continue to be as frugal as we can with our budget monies so that we can continue to pave more and pay less. Thank you.
The honourable member for Inverness on his first supplementary.
Well, Mr. Speakers have highlighted it's an inefficient use of equipment. Our independent truckers provide better value for our tax dollar. The trucks this government is using to pave roads with the NDP road paving plan are actually designed to plow snow. They have extra heavy-duty frames which limits how much material they can haul when working on paving projects. My question to the minister, when will the minister end this experiment into road paving and leave this work to the people who can do just as good a job for less cost?
The Honourable Minister of Transportation, Infrastructure, Renewal.
Thank you again, Mr. Speaker, and I thank the member for the question. As the member will know, this is the first year that we've engaged in the asphalt paving, and coincidentally, we've started paving in his neck of the woods up in Cape Breton. We were up there earlier this summer and paved, I believe it was 28 kilometres of road in the Victoria County area. What I want to say is that we don't intend to stop this. He's suggesting we stop this process. We don't intend to stop it at all. And when he's asking for an analysis of how much it's going to cost, we were very open and transparent with the people of the province. And we said at the beginning, we will look at this after 3 years, determine how it's progressing, and assess it at that time. Thank you.
The honourable member for Inverness on his final supplementary.
Mr. Speaker, the more pavement I get for my constituents, the happier I am. And the less it costs, the more we're all going to get. So, Mr. Speaker, this summer, this government was once again slow to get tenders out for paving projects. Getting these tenders out earlier in the year allows bidders to optimally plan their construction season and bid on more tenders. More bids would bring us lower cost paving, and that means we'd all see more roads paved. Truckers sat around at the start of the summer with no work. They told me that themselves, only to be swamped with work when this government finally got all the tenders out. So my question to the minister, will the minister commit to getting paving tenders out well in advance of the 2013 construction season so we can get more paving completed and so that these independent truckers have an easier time making their living?
The Honourable Minister of Transportation, Infrastructure, Renewal.
Again, thank you, Mr. Speaker, and I again thank the member for that question because it does give me an opportunity to advise that we have been looking at this issue. It is an important issue to get tendering done as early as we can, and we are looking at that. I anticipate that we will have an improvement over what happened up until now in terms of tendering. I'm not going to give an exact date, but I know that through my staff, we've been looking at this issue, and I am anticipating that tenders will be issued earlier this year than has been the case in the past. Thank you.
The honourable member for Bedford Birch Cove.
Mr. Speaker, the Bedford Waterfront Development Corporation approved a plan to infill and develop a 39-acre site on the Bedford waterfront back in 1985. The community group Save Bedford Waterfront is concerned this infill plan will envelop Crosby Island and the adjacent reef. This is a well-founded belief, Mr. Speaker, because the plan the Bedford Waterfront Commission presented to Bedford Town Council back in the 1980s shows quite clearly that Crosby Island would be engulfed under this plan, and I'll table that. My question is for the Minister of Environment. What other disposal sites for pyritic slate other than Bedford Waterfront has the government identified?
Of Environment.
Well, thank you very much, Mr. Speaker, to the member opposite for that question. I can tell you that the site that you're talking about, the Bedford infill, is something that the slate there is something that's been approved by federal government, and it's something that we're monitoring, and I can tell you that that material is approved, and we'll continue monitoring the situation. I thank you for the question, and the member opposite has raised that question before in the House, and I thank you again for that.
The honourable member for Bedford Birch Cove on her first supplementary.
Thank you, Mr. Speaker. Are there any plans to stop dumping Pruitt slate into the basin, into the basin, and if so, when would that be?
The Honourable Minister of Environment.
Again, Mr. Speaker, to the member opposite, this particular material has been approved by our federal government. It's something that we approve of, and this project is ongoing. And again, I thank the member opposite for bringing this question continuously to the floor of the legislature. Thank you again for the question.
The honourable member for Bedford Birch Cove on her final supplementary.
Mr. Speaker, I think I can promise I'll keep bringing it until I actually get an answer. I don't know if any of the ministers have been by the waterfront recently, but much of it resembles a moonscape. It's ugly and dusty, and the residents there are sick of looking at the mess. So my question to the Economic and Rural Development and Tourism Minister, are there any plans to mitigate the moonscape there until such time as development starts, if indeed development is approved?
The Honourable Minister of Economic and Rural Development and Tourism.
Thank you, Mr. Speaker. Mr. Speaker, it's certainly my pleasure, and as the member is well aware that there's been lots of consultation, public consultation, with respect to the infilling at Bedford Basin. Actually, Mr. Speaker, it was just a matter of weeks ago, months now, that we put a halt to the infilling to allow for further consultation and continue with our due diligence, Mr. Speaker.
The honourable member for Halifax Clayton Park.
Mr. Speaker, in the face of massive NDP handouts of hundreds of millions of dollars to big corporations, the NDP has refused to commit to extending tax rebates to companies that are here in Nova Scotia and employing people in an industry that traditionally pays an above-average wage. Mr. Speaker, the digital media tax credit has helped companies in the industry and in our province, but it expires in a little over a month. My question, Mr. Speaker, is to the Minister of Finance. Will the Minister of Finance commit to extending this valuable tax credit past January 1st, 2013?
The Honourable Minister of Finance.
Thank you very much, Mr. Speaker. Mr. Speaker, the digital media tax credit is indeed an important support for what I and my colleagues here consider a very important industry that make a significant contribution to the province. I have said that I am looking at the credit. I understand it has an expiry date, and I will have something to say on that in the not-too-distant future, Mr. Speaker.
For Halifax Clayton Park on her first supplementary.
Mr. Speaker, my problem is that it's already November 21st, and this credit will expire in the end of January. So we're within almost 2 months at that time. And this is an industry that as every other industry, requires some planning and advance time. Companies can't operate with that level of insecurity. So, Mr. Speaker, that is my biggest concern. I don't hear an answer from the minister. I'm not pleased to hear that we have to wait longer on that. There is also a problem, Mr. Speaker, that they are not using a clear and informed process to evaluate applications. And by many accounts, this process isn't being handled properly within the Department of Finance. They are not using digital media experts to assess these applications. They're using internal accountants or others to judge the merits of an application for the digital media industry. So my second question for the minister is, Mr. Speaker, why has this minister put in place accountants and financial advisors to judge whether companies are actually operating in digital media?
The Honourable Minister of Finance.
Thank you very much, Mr. Speaker. We don't have too many filmmakers working in the Department of Finance. We do have accountants. It is a tax credit, and the criteria that applies to a tax credit is, in fact, a financial calculation, Mr. Speaker. However, let me say this, that the current tax credit costs approximately $3 million this year. Since it was introduced, more than $10 million has been spent on this tax credit. That is not an insignificant amount of money. It's a significant amount of money, and it has provided support to about 130 different productions. And as I said, I will have something to say quite soon in terms of the future of the tax credit.
The honourable member for Halifax Clayton Park on her final supplementary.
Thank you, Mr. Speaker, and I appreciate that there are not any film makers in the provincial, I guess, on the provincial payroll. But the difficulty with this industry is that we are using a definition for digital media that is not the industry standard. And a company named Stitch Media was recently here in the province and was hiring people. They've had to leave the province after actually taking the government to court and winning in court that a ruling that said, and I'll table this, Mr. Speaker. It says, in an oral decision, Judge Kevin Cody ruled that the Finance Department's ruling failed to meet the necessary criteria for being justifiable, transparent, and intelligible. So basically, the tax rebate was not given to this company, even though it would be allowed in Ontario and in Quebec. The company has since left the province. So, Mr. Speaker, my question to the minister is, will she consult with the digital media industry experts and fix the flawed application process?
The Honourable Minister of Finance.
Thank you very much, Mr. Speaker, and I thank the member for the question. It is the case that I'm looking forward to meeting with members of the industry, and I have met with members of the production industry, the film production industry. This is a very particular subset of that industry, and I will certainly take the opportunity to meet with them after this legislature has risen for this season, Mr. Speaker.
The honourable member for Dartmouth North, Dartmouth East.
Thank you. Thank you, Mr. Speaker. Mr. Speaker, my question is for the Premier. Over the past, the past few months, past year, I guess, in discussions over Muskrat Falls in this House and in the media in Newfoundland and in Nova Scotia, there has been considerable conflicting information from various sources. And so I think the Premier must understand by now that there is a need and a desire by Nova Scotians to have accurate information about this project. The Premier continues to say that this is a good project and yet has been unable to provide the information to back that up and therefore cannot seek all-party support as a result. My question for the Premier is the Premier working as closely with the Emira as he seems to be lately with Nova Scotia Power to release an updated cost of the Maritime Link portion of the project?
Honourable the Premier.
Thank you, Mr. Speaker. Certainly the energy future, not just of Nova Scotia and Newfoundland, but of the entire region, will be affected by the Lower Churchill project, and then ultimately what will happen on the Upper Churchill, and of course the expiry of the agreement between Hydro-Quebec and Newfoundland. So what this project does is it looks out to the future for energy consumption in the province. What we are doing is we're working to ensure that this project gets an appropriate vetting, that the information that is required is there. Of course, there is a process whereby that will go through the Utility and Review Board. We are, of course, anxious to have the first requirement satisfied. And the very first requirement, Mr. Speaker, is to have this project approved in Newfoundland.
The honourable member for Dartmouth East on his first supplementary.
Mr. Speaker, there have been numerous hurdles, and even in Newfoundland, I'm sure, if I heard the Premier correctly just now, he said the first step is to have it approved in Newfoundland, and I think we all know that the Premier there has now introduced a private member's bill which will only allow 2 hours debate on it there, so I'm sure that that will get approved by their government. Mr. Speaker, the agreement upon reading it, shows that there is no ownership. The ownership of the Maritime Link goes to Nalcor after the term, and there is no guaranteed amount of energy. Reports in Newfoundland, both from the Newfoundland government and from private sources, have indicated that much of that energy will be required by the nickel mines, which will be in production at that time. So, Mr. Speaker, has the Premier looked into the issue that much of that energy may be required by the nickel mines then, and we may need an alternate source after the 25-year or 35-year period in the agreement?
56. Honourable the Premier.
Mr. Speaker, of course, as you would know, Muskrat Falls is supposed to be phase one of that project, with Upper Churchill being the second part of it. We'll, of course, look forward to that complete development taking place. But, of course, we understand that after 35 years, all the projections that we have seen suggest that there will still be power that we would be able to take, not only what was initially committed, but in fact we'll be able to take at the New England price less transmission, so it would be the cheapest available power for Nova Scotia and continue to make up part of the portfolio.
The honourable member for Dartmouth East on his final supplementary.
Well, thank you, Mr. Speaker. And with only a few seconds, maybe I'll ask the Premier to table that information if he's able to do so at some point in the next few days, since the information from private sources in Newfoundland seems to be suggest the opposite. Thank you very much.
Honourable the Premier. Order, order. The time allotted for oral questions put by members to ministers has expired. Before we get down to the business opposition business today, I noticed that earlier the member from Pictou East had put an attachment or tabling something with a resolution. That is not Resolution 261, which you are not allowed to table attachments or anything with that. I'm therefore directing the document which the honourable member sought to have accompanying the notice of motion be struck from the record of the House, that it does not form a part of the record of the proceedings of this House. Thank you. The honourable House Leader of the Official Opposition.
Just trying to be helpful, Mr. Speaker. Would you please now call Resolution 1466 for debate?
Resolution 1466.